Hi, this is Sutri Fugar from Rush University. Oh, okay. Hi, this is Sutri Fugar from Rush University Medical Center. I'm here with Dr. Ferdinand. He's a professor of cardiology at Tulane University here in New Orleans, so he is home. This is ACC 2019. Dr. Ferdinand, it's a pleasure to have you on Fit on the Go. Just the first question is, what are you most excited to hear about at ACC 2019?
Well, the preventive guidelines are coming out. We had the hypertension, high blood pressure guidelines 2017. We had an update on the cholesterol guidelines. They're going to kind of put it together. I really believe it's important that we decrease the burden of cardiovascular disease. We're not going to be able to angioplasty our way out of death and disability.
So in line with prevention, are some of the approaches that as fellows and as general cardiologists that we can do to try and catch patients earlier before they get to the stage where we need to plow our way through coronary plaques?
I think doing interventions is absolutely necessary. So very high risk cardiac burdens. But if you're going to turn down cardiovascular death rates, you have to prevent it. So I would suggest when you see patients, regardless of the reason you're seeing them, check the lipids, check the blood pressure, and intervene as is needed. And you need to learn more about these anti-diabetic medicines, the SGLT2 inhibitors, the GLP-1 agonists, because the outcomes with these trials are very robust. They're actually better for cardiovascular protection than they are just for glucose lowering.
Another question I have is, I've been in the stress lab and I've noticed that a lot of the people who come in young age with ESRD are African American gentlemen. I know you're highly involved in ABC and also involved in trying to reduce the disparities in healthcare. I just wanted to know what are some of the opportunities that as fellows in training we can get involved in and trying to reduce these disparities.
If you look at end-stage renal disease, although African Americans are about 13% of the population, persons who are on dialysis, it's 3 to 4 times that. So we need to decrease the burden of end-stage renal disease primarily by controlling glucose and controlling blood pressure. We can evaluate these patients early before they get to dialysis and prevent them from going to end-stage renal disease.
Well, thank you very much for interviewing with us today. If for more videos, go to youtube.com/fitonthego.